Hello and welcome to Empowered Health. We have a lot of great new segments this season, VJ.
That's right, Michelle. We'll see reoccurring segments on dental and eye health and check out some of the cutting-edge research in chiropractics.
But before we get to that, we're going to meet Jim Boys and learn a little bit about an emerging practice, art therapy.
Jim David Boys is an artist. His inspiration comes from the tapestry of his life. In fact, it is art that saved his life.
I was desperate, I was frightened, and I didn't know which way to turn.
The drugs offered him a temporary place to hide.
Everything I worked for as a young man, I lost. It was just like I was on a bent for suicide, passive suicide.
While working at the Hastings racetrack, Jim discovered art therapy. From there, everything changed.
Art is of course an expressive thing that you can use. Art works with colors, that of course connects with someone's feelings, and it works with different textures that also can connect to memories and feelings. So both the textures and the colors, then of course the expression of what you make is part of your process as well. It's in art therapy very important that the person is free to express whatever.
For Jim, that's exactly what happened, and then he noticed something else.
My anxiety decreases immensely. There was an acquaintance of mine, Wayne, who worked in the barn with me, and he saw how stressed I was with the go, 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 the rock and roll. We have to move these horses and get them back in, and it's like stressful. And then he saw me painting. He says, "Jimbo, I've never seen you so relaxed."
And of course there is more than a catharsis. You can also really make shape of anything that happened in the past that you couldn't really put in a box. Maybe something happened when you were really young.
When I work at a canvas and I see that I am producing something, I'm creating something, I have a sense of purpose and I feel confident.
And that totally connects with what I'm saying, because if you push your experiences down, they are always somewhere there. So you have to cover them up. But if you let them come out, then you can actually touch them and you can give them shape and you can think about it, think through it.
Art is allowing me to reclaim my life. It will have been 2 years alcohol and drug free come next Monday.
Visit us online at vancouversun.com/empowered health to share your personal health stories, ask questions of experts, and leave comments about the series or suggest topics for future episodes. And be sure to pick up a copy of the Vancouver Sun newspaper every Thursday for more empowered health stories and tips. We'll be right back.
Welcome back. Michelle, I'm noticing that more and more people are doing detoxes these days, especially after the holidays. But I wonder how good they really are for you.
I wondered that too, and there are so many different types of detoxes. It can be overwhelming, but that's exactly what Randy Shore is going to break down for us today. Let's take a look.
Does your body require periodic detoxification to function at its best? There's a whole industry based on this idea, and many millions of dollars spent to aid the process, including herbs, vitamins, and enema equipment. Frankly, I can hardly believe that I have to stand here and talk about the enema craze, but craze is the operative word here. Your body does require detoxification and waste removal. In fact, a good deal of your standard equipment, liver, the kidneys, and intestines, are designed just for that purpose. They operate 24/7, ridding your body of noxious substances, purifying your body's fuel and fluids, and then disposing of the resulting waste. It's a remarkable system, evolved over millions of years to keep your body functioning at peak performance. Even when we persistently poison our bodies with drugs and alcohol, it does a remarkable job of filtering, converting, and disposing of those toxins. Commercial detox systems claim to stimulate the liver, get the body's natural systems revved up, and flush away sticky waste, usually with a fast, vitamins, and herbs, which you have to buy, plus colonic cleansing. The theories promoted by the people who sell these products vary enormously, and none has a stitch of legitimate science to back their claims. The underlying premise is that our bodies are static, and that fat and tissues are inert and need to be stimulated when waste builds up. The truth is far different. Body fat is constantly being burned, converted, and redistributed. Our cells are constantly being sloughed away and replaced, even in the intestines. The body's filters are always on. This fad drives the scientific community crazy. A lot of the treatments are fairly harmless. A week of fasting won't kill you. You might even drop a few pounds. Probably not permanently. The vitamins will be washed away by your body's natural systems. They won't do you any harm, but they won't do you much good either. As for performing a home enema or having one done by an alternative therapist of some kind, don't. Your intestine is not dirty. It's a finely tuned instrument with an important job to do, one you do not want to interfere with. You risk vomiting, headaches, infection, cramping, and even bowel perforation. You could trigger a form of water intoxication or even a heart attack, according to the Mayo Clinic. And a coffee enema? Really? If it sounds crazy, it probably is. Let your body do its work. There's not a shred of scientific evidence that detoxification does any good at all. You want to cleanse? Have a glass of water with your mouth. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Hello and welcome to another episode of Your Spine, Your Health. I'm Dr. Don. This series that we're starting tonight will take you into research and education. Well, research and education about what, you might say? Well, it's about the spine. Last season, we introduced you to 24 segments of your spine. You have a back. Now, while this may sound a little funny, as we tried to educate and inform before, the spine is about bone joints. It's about function. So when you get up in the morning and you try to lean forward and you may have pain to brush your teeth, you don't suddenly say to yourself, gosh, I think my fourth lumbar's hurting. Nor, if you put your hand behind your back, do you clearly touch the vertebrae, the bones themselves. And of course, you can't see them. So the difficulty in understanding the back, the spine, and its role in your health is what we first address as making you aware that you have a back. However, while it may be easy to understand that these are bone joints and there's muscles and there's mechanical movement, the real value and importance to this is the spinal cord and nerves that pass down through those 24 vertebrae and the nerves that come out between each of the 24 vertebrae. Remember that the care you receive today is usually based on the outcomes of yesterday, and that's where research and education constantly refine the healthcare system. We know about research and education discovering new things for your treatment, and we try to apply that on a daily level in practice-based evidence. Your healthcare is paramount not only to give you the right diagnosis and the right care all the time, but we also have to address matters of prevention. Spine and spine-related problems, as we know, occupy at least 1/3 of all daily Medicare utilization. It doesn't matter if this is a workplace injury or a car crash injury. There's all kinds of information that we have from those sources that tell us what happens in these events, what should the diagnosis be, what will the care be, and the predictable outcomes. We know this largely at least 80% of the time. For those other 20%, we have to work in a multidisciplinary environment to try to find solutions for that. But in the meantime, the care that you receive is always trying to reflect on research and the education of your family chiropractor. As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow and better healthcare outcomes for you.
Today we're going to show you how to choose the most effective exercises for fat loss and overall fitness. When choosing exercises for your workout program, it's important to choose effective exercises that are going to be most efficient for your fat loss and overall health goals. Now, Simona, I'm going to get you to go ahead and start with a bodyweight squat. Now, these exercises are basically compound exercises, which means they're using multiple muscle groups over multiple joints. As you perform this, you'll notice that you're going to be using a lot more energy, which means you're going to be burning calories in less time. And for people with a busy schedule, this can be really important.
After the break.
Optics are extremely important, but it's also important how that optical system interacts with the more important mechanism, which is our brain.
Welcome back from our spines to our teeth and eyes. Next, we're going to talk to Dr. Bahi about dental implants. What are they? What is the process? How important are they to our health?
Then we'll start our ongoing series on eye health. Take a look.
Today we were talking about the benefits of dental implants. So what are dental implants? They're the most important innovation in dentistry in the last 40 years. In the past, and that's not so long ago, the loss of a tooth led to a permanent defect. Not now. With the advent of dental implants, we can offer far better replacement options for missing teeth. A dental implant is essentially a titanium screw that replaces the root of a missing tooth. In the past, we could only offer our patients two options. One option was a partial denture. Unfortunately, these are removable, uncomfortable, and the patient is in constant fear of losing their teeth while talking, eating, or speaking in public. Namely, they couldn't enjoy the same foods as before. The second option was a bridge. Here, the adjacent teeth are shaved down and damaged to accommodate the dental crowns, or caps as some people refer to them. This prosthesis normally lasts about 9 years and needs to be replaced several times in the patient's lifetime. It also unnecessarily damages the adjacent teeth. Dental implants are a far superior option. They are permanent, in other words, they do not need to be replaced, and they do not limit the foods that you can eat. And the really great news is they can be placed with minimal pain and recovery. Here's a rundown of the process. After a review of your medical and dental history, a set of three-dimensional X-rays are obtained from an in-office CT scanner to assess the bone in the area of the missing tooth. From these three-dimensional X-rays, we plan and place the implant with computer-guided surgery software. The software allows absolute accuracy in the positioning of dental implants within 1 millimeter. If adequate bone is present, a series of drills is used to prepare the site. The implant is placed to a minimum amount of torque and then is left to go through a healing period. In this time, the bone will grow and adhere to the surface of the implant in a process called osseointegration, literally joining it to bone. Once healing is complete, a second component, called an abutment, is attached to the implant using a titanium screw. Finally, a crown is then fixated to this abutment to complete the process. In certain circumstances, this is all done in one day. However, this is highly dependent on the clinical condition of the patient.
It's really a living organism, and if you think of it this way, optics are extremely important, but it's also important how that optical system interacts with the more important mechanism, which is our brain.
Your eyes are an often overlooked part of your health, and yet they are commonly referred to as the windows to your soul. Well, that's partly right, because your eyes are so much more. Let's take a look at how they work.
They're an extension of brain tissue, in essence, and they sit in our skull, in our head, and there's no connective tissue, there's no bone. They're two fluid-filled spheres that move around with muscles attached to them. They focus the world that we see, they allow us to orientate around the world, but they're actually quite complex organs that often we don't give the right amount of attention to. The main one is probably the cornea and the lens in the front of the eye, which act like a focusing mechanism to bring light into focus on the retina. The retina then basically acts like a conductor where it sends the signal or the visual flow to our brain. Amazingly, the brain actually does the seeing. The eye is really the conduit to which the information gets to the retina. The real beauty about the optical system of the eye is we have a cornea that is aspheric, so it basically tries to reduce the amount of distortions in terms of what we see, and then you have a lens inside the eye which actually controls how much focusing we need depending on what distance that we're doing tasks.
The two largest brain maps we all have are the occipital lobes, one for the right eye, one for the left, and they occupy the space at the back of your head.
So actually the eye can be a really interesting conduit in terms of your overall general health. They're absolutely essential. I mean, if you look at how we navigate the world around us, we're driving, there's peripheral targets coming into our vision, just basic functioning in the world, it's about anywhere from 70 to 80% of our ability to function is visual in nature. And if you think about what you do on a daily basis, think about from when you wake up to when you go to sleep, when are you not using your vision? Our visual system has to be able to act like a sonar in order for us to judge how far away objects are from us. And I think probably the single best advice that I give to a lot of my patients is, you know, look after your eyesight. It really is precious, and it's like the old cliche, you don't miss something until you lose it.
Coming up on Empowered Health.
Chocolate?
Chocolate.
That's my favorite.
It's everyone's favorite.
Yeah, okay, let's get started then.
This cooking and nutrition portion brought to you by Save On Foods.
It's cooking time on Empowered Health, and I'm here in the kitchen with chef and holistic nutritionist Andrea Potter from Rooted Nutrition. Andrea, welcome to the show.
Thanks for having me.
So what's today's recipe?
So we're making a raw chocolate ganache tart today.
Chocolate?
Chocolate.
That's my favorite.
It's everyone's favorite.
Yeah, okay, let's get started then.
So we're going to make the easiest crust. Even if you think that you can't make pie or you're not good at baking, this is the perfect crust for you because you don't need to bake. So we'll start with the crust and take your almonds.
And you use them with skin?
I use them with the skin because the skin is just fiber, and in holistic nutrition we're not afraid of fiber. Absolutely,
yes. It's good for you, we know that.
We're simply going to pulse this so that it comes together, and I'll show you the texture once we get started.
Okay.
So this is kind of like unbaking. We really don't have to measure a whole lot.
Right.
There's not a lot of chemistry involved in this. And I'm using a 9-inch pie springform pan.
Okay.
And a little trick that someone showed me once is that if you take a parchment, put it on the bottom of the pan, and then put the ring over top, this makes it easier so that when you slice it and serve it, it doesn't get stuck on the bottom. Great, so I'm going to get you to press this in.
Spread it across
Just
evenly?
spread it across evenly and then push it in with your hands.
Yeah.
I could even get a spoon in there if you want to use the back of a spoon. Cool. I'm just going to smooth this out a little bit. So this is what it's looking like when it's ready.
Right.
And this kind of sets in the fridge as well. Once the filling is in, then we'll put it in the fridge for a couple of hours until the filling sets.
Okay.
Okay. We're ready to move on to the filling?
Sure.
Great. Filling ingredients. I'm going to start with the dates. So dates first.
Agave syrup.
Agave syrup.
Okay.
This is one of my favorite liquid sweeteners. Did you want to add the chocolate powder?
Right in here?
Yeah.
Okay.
And I'm just going to pour off the water for these cashews.
Chocolate powder. And how long did you soak the cashews for?
I soak them for at least half an hour just to soften them.
Get the vanilla.
A little bit of vanilla for flavor. So you could put orange zest in here. Some people love chili chocolate. It's kind of trendy right now or whatever, so you could put some chilies in there.
All right.
Yeah. So then we're going to add the oil in a minute. Firstly, I just pulse it in the food processor or the blender to get it going.
Right.
And then we're going to add the coconut oil.
Okay.
Awesome. Did you want to pour that in there? And I'll give you a spoon.
Right on there?
Yep.
Okay. It's become quite creamy actually, yeah.
And this is a really nice make-ahead dinner for when company comes over or what have you. It sets and it stays in the fridge, tastes fresh for about 4 days or so.
Okay. Yeah. And then spread it across?
At this point, I usually just kind of shake it around so it's nice and flat on top. There we go.
So the crust is totally covered now.
Yep.
Yeah. Awesome.
Great. So we'll put that in the fridge, let it set for a couple of hours, and then we'll come back and taste. I wanted to garnish it with a little bit of pomegranate.
Wow, that looks beautiful. Let's do this. Oh, Andrea, this is awesome.
I agree.
You can find out more about this recipe in today's Vancouver Sun or online on vancouversun.com/empoweredhealth. Andrea, thanks for being on the show. I'm going to finish all of this. Chocolate is an all-time favorite, but we see a lot more of it on store shelves in the month of February for Valentine's Day. And to talk more about chocolate, I've got registered dietitian Melissa LeBlanc with me. Melissa, welcome to the show.
Thanks, BJ.
So, what are the different types of chocolates available?
Well, chocolate comes in many different forms. You have white chocolate, you have milk chocolate, and you have dark chocolate.
Dark chocolate, okay. Let's talk about that. I've heard a lot about it of late, and it's supposed to have some great health benefits as well. What are the health benefits?
Well, dark chocolate compared to milk chocolate, let's say, is lower in fat and sugar. It also has more antioxidants, so it's good for the heart.
Melissa, when I go to the grocery store and I see dark chocolate, it's got these big numbers on it. It says 70%, 85%, some even say 90%. And my interpretation is that the higher the number, the bitter the chocolate. But there's got to be a deeper meaning to this, right?
Well, you're on the right track. So chocolate in its most purest form comes from cacao beans. So the higher the percentage of your chocolate bar, the more cocoa solids there is, and the more bitter it's going to be.
Right.
So here we have ground cacao beans. So that's the most purest form of chocolate you can find.
And the most bitter one as well.
That's right.
Okay, but it's got great health benefits because no sugar, no fat.
That's right.
Okay. Melissa, after listening to everything you've told us about dark chocolate, I would love to eat more of it, but I've just got one question. When I eat dark chocolate, it does not satisfy me. Do you have any suggestions to counter that?
Absolutely. So you might be lacking a bit of the sweetness. So try pairing it with your favorite fruit. So strawberries or even some dried fruit like peaches or apricots is a perfect way to enjoy dark chocolate.
Well, I'm going to try that for sure, Melissa, and thank you for being on the show and telling us about dark chocolate.
You're welcome.
Thanks.
Well, I certainly learned a lot on today's show, and Andrea Potter's chocolate ganache looked absolutely delicious.
It was, and really healthy as well. For more information on any of the stories you saw on today's show, check out today's Vancouver Sun newspaper or the Vancouver Sun website.
We'll see you next time.